All right, so today we're going to talk about what we would do or say to ourselves, our newly diagnosed selves. So, if it's your first time listening to us or here with us, we are the Crohn's and Colitis dietitians. We're all dietitians specialized in IBD, and we all happen to have IBD as well. So, we definitely have a unique perspective to add to this conversation. Uh, yeah, I think what brought this topic up for me is I noticed that Danielle's reel that she did a while back on what was it? What I would tell myself.
Oh, something about I've had Crohn's for 20 years. Here's what I want you to know.
Yeah,
Yeah.
and it resonated with so many people. I think it's one of our top viewed, like 100,000, over 100,000 people viewed it, and it's very commented on. And I think it really resonated with people. One, because you mentioned having it for 20 years. It's a long time. And I think people often feel really alone during that time, and it can be very hard and hard to know which way to turn. And so I think I was just interested in how much it resonated with people, and yeah, I thought it'd be a good conversation to have.
Yeah. So, Ashley, what would be one of your top things for people to know?
Yeah, so I did my own version of this weekend. I think the biggest thing that I did when I was first diagnosed that I would not do now is I waited way too long to get help, and it left me in some really dangerous situations. And what I didn't know about IBD at the time was just how you really have to monitor it. Like, you have to look at your labs regularly, you have to get scopes regularly, you have to come to the acceptance of, like, this is what I have, and it's going to require me to watch it. Because you could be like me, or like I didn't have enough symptoms all the time to really for me to recognize when I was having inflammation. I mean, doesn't always go hand in hand. And or you could also be where I was, which is like you're used to pain, like you're used to feeling a certain level of not great. And you get more and more used to that over time, especially if you've had IBD for 10 years. And sometimes things can sneak up on you. And so the biggest lesson that I learned is to not freeze when you're in a flare, um, to get help. I think you have when you're like traumatized, you have your fight, flight, freeze moments, and for me, I think I kind of froze a lot of times when I was in those moments, and now I just really try, no matter how I'm feeling about it, to keep moving forward and to get help and right away. Recently I had been in like a really good spot with my ABD, and then I had started to come off of medication a little bit for a bunch of different reasons. And I started weaning a little bit and weaning a little bit, and then I went a little too far with it. And so then I started having those signs of like, maybe this is a flare. And so then I tested, and I wanted to make sure I didn't make the same mistakes I've made in the past. And to be fair, it's really scary when you have those signs, especially if you've had serious flares before where you've ended up in the hospital or you've ended up in really life-threatening situations like I have. It's can be kind of traumatic. And so yeah, it's hard. Um, it's hard. I definitely get a lot of emotions about it when stuff like that happens, and you sort of blame yourself. Like in my case, I had a valid reason to sort of blame myself a little bit because I had come off of medication, and I would never tell a patient to do that. But it's tough because you get in these spots where it's lifelong, and it's sometimes hard to accept that. And no matter, like, I've had IBD for 15 years, but it's still hard sometimes. It's still hard to accept it, even when you're feeling good, that you're supposed to continue and that you can have side effects with things. I mean, that whole picture is just hard to digest. Um, but anyways, I the bottom line, that was a long way of saying that I would tell myself to get help soon and to really lean on that and to find your team of people that you trust. I think that is so important.
Yeah, I agree. I was gonna say something similar, like find people that are trustworthy for you to listen to, because I think I felt like I did that fairly well, like really soon after my diagnosis, and I was so thankful for that because I had high quality answers to a lot of my scary questions relatively quickly, and I felt like I could trust what they were telling me, and I could have confidence in the treatment plan that we had in place, and could kind of have some of the what ifs addressed early, because it is really really scary when you're in that, when you're first diagnosed, you're flaring, things can kind of just, they're just unnerving. You don't know really what's going to happen, and so finding high quality resources is, I think, really imperative, just for especially my kind of personality. I was like, okay, we're in this. I want to know what's happening, what's going on, what I can control, the things that I can do, and all of those types of questions. But
So you didn't want to go to Reddit, Krista?
Yeah, I was gonna ask that too.
maybe I wanted to, but I was like, no, don't do it.
Yeah, so you kind of treated it professionally. Like, I want the best of the
You
best.
did,
I want to,
yeah.
I want to like go for the gold with
Yeah, and
my.
guess what? That's how I ended up here, because I went to Crohn's and Colitis dietitians first.
Oh, that's a nice compliment.
I really did though. I mean, obviously you're with your medical team, but I was like, I need to know what else I can do, and obviously this is related to the gut, so I needed to find nutrition resources, and obviously being a dietitian, I'm going to be a little more, leaning that way, and so yeah, finding Ashley was really 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 helpful, because you kind of pushed me to find an IBD specialist. I was just at a GI, and that was a really helpful step to kind of be like, oh, okay, there are specialists out, like you just don't know. There are centers that focus on this, and there are people out there that are really, really knowledgeable, and they can kind of lead the charge as far as your treatment plan goes. And then you have a role with your nutrition and the ways that you can advocate for yourself and ask your team certain questions, and how to stay on top of those labs and figure out where inflammation is and stuff. Me having some agency in that was really empowering.
I had forgotten about that conversation. It's been so long. It's been
Yeah, yeah.
like 5 or 6 years, I guess. But it's I'm glad we were able to have that conversation. And I think I think for me it was healing to be able to have that kind of conversation with somebody, because that was like ten years into my diagnosis of felt like
Yeah.
walking through mud or quicksand, like when you don't have those anchors of like knowing the lay of the land and knowing
Hmm.
um, where you need to go and what's the best. And it's certainly nice to be able to do that for people.
Yeah, that's so true. And I did have, like, shockingly, the I can't remember if it was the IBD center or if it was through the GI, but at any rate, I did have access to a dietitian, and I worked with her just really briefly right after my diagnosis. Um, and no knock to her by any means, but she more or less was like, "Oh, you're eating fiber, great. You're tolerating things, great. Like, I don't need to see you again." Um, and on one hand, I was like, okay, that's kind of reassuring that I'm doing some things that would be appropriate for IBD, but also, like, I can go to the nutrition care manual and find a handout, and that can kind of be the education and the recommendations. But I was looking for more, and so being able to have a more full conversation and with someone who has the disease, like, that meant a lot more, and I had a lot more to use, go forward with.
I think you might have been the first dietitian with IBD I met. Also,
Really.
like, yeah, because I remember. I think after I met you, I started to meet other dietitians too that had IBD, and that was really interesting to learn that there were so many healthcare provider, not just dietitians, but healthcare providers that are living with it that, they're not always going to disclose that to we do, obviously on YouTube, but not everybody does. But it's interesting. It was interesting to me to learn like how many providers are actually dealing with this.
Yeah. Yeah. Danielle, what about you? What do you want to hear?
Danielle?
What would I want to know if I was newly diagnosed?
Yeah.
I think one of the biggest things, because this didn't really land with me when I was a teenager, when I was diagnosed, was you can have inflammation and have no symptoms. You can also have inflammation and a lot of symptoms. And that's just like a big piece to be mindful of. So then, to add on top of that, being really aware of the labs that we like to take a look at around inflammation. So, of course, gold standard we want to do a scope, but scopes aren't always at the ready, especially in Canada. It seems like it takes forever to get a scope. So, doing your stool test, your fecal calprotectin, and seeing where your CRP levels, which is a blood test, understanding where your inflammation is. And to take it another step further in like understanding the numbers around inflammation. Because I feel like if my GI, when I was a teenager, would have told me, like, oh, this is your inflammation, this is where we want it to be, I would have reacted maybe in a different way, or maybe understood things a little bit differently. So, just that understanding of where your inflammation is at can be really helpful in, like, okay, is my current treatment plan working? Do I need to take certain steps to further progress and see how it can affect my inflammation? So that's just a really big piece I like to talk to people about, because even now with patients, I hear them say, oh yeah, I hadn't heard about the fecal calprotectin before. I'm like, why are we not looking at this? And I mean, you know what, some people don't love those stool tests either, and there's always a lot to talk about in those first few appointments when you're being diagnosed with something. But I want people to know about that so that they can have an understanding of what that inflammation is, the numbers, where we want it to be, and that kind of thing.
Yeah.
Yeah. And to be fair too, like I think there's a chance maybe these things are ran. And there's so much when you're first diagnosed too that I know I was just like, you just feel so overwhelmed. You're not thinking about, you don't know what fecal calprotectin is. You don't know what IBD is for that matter. It's just like, there's so many new things. I think when I was told I had IBD, it was right after a colonoscopy. They're like, we saw lots of inflammation, and you're just like, it doesn't feel real. Like I still had medication in my system. I think I laughed when she told me. Like it was like, no, I don't. That's not true. I think there's you're told at times like that, or like a week later, and it's in 5 to 10 minutes that you're hearing this big news, and you're like, well, whoa, what's next? And you kind of leave the conversation with lots of questions. And so I think there's that going on too, that I think, it's a lot to take in, number one. And then you have these healthcare systems where it's hard to have time and space for all the questions and everything that you would want to cover, which can be an issue on its own. But I agree. I do think it's something people, I see what you see also in that. I see that sometimes people aren't being monitored in the way that I think they should be, like in terms of checking their inflammation regularly and sort of predicting or getting ahead of flares instead of kind of waiting around for the next flare.
Yeah. I feel like we all had a common thread of, I think your gut reaction in that situation is like fix it mode a little bit. Like, okay, what can I do in this to kind of ease some of the shock, of it, or ease whatever the symptoms that I'm feeling? That's going to be kind of our gut reaction to getting a big diagnosis like this, and all of us kind of mentioned various ways, helpful ways that you can do that, getting help, finding high quality resources, finding out the answers to a lot of these questions so that you can better advocate for yourself and you can get good quality help. But I think again that kind of helps empower you and helping you understand that you do have a role in this, even though this diagnosis has been placed on you and you didn't do anything to make that happen. This is what it is, but you have a role in it too, where you can kind of feel empowered and you're not alone in it.
Yeah. And it wouldn't be right if I didn't mention too the other thing that is big that I would have liked to known about, when I was diagnosed is malnutrition. And, last week was Malnutrition Awareness Week. And then we also created some great resources on that topic. We created a checklist last week for patients, and then we created something for providers as well on the topic of malnutrition. And, I had no idea. That like low appetite and skipping meals, I read about it, when I was learning about IBD, but I thought, well, this is a normal part of IBD, and you're told kind of like, well, yeah, that's normal to have low appetite. It's normal to have weight loss. But it's not until like in the last 5 to 10 years that I was like, okay, yeah, just because it's normal doesn't mean that it's a good thing. This could actually be harming me in my journey and preventing me from actually seeing remission. It's that big a deal. I think I wish I would have liked to have known that, in my early on as well. So I wouldn't have been, less likely to be stuck in a, 10-year flare. Could have had maybe potentially get that under control sooner.
We could really go on and on and on about this topic.
Yes.
There's a lot that we could say to give our advice on. But another really good piece that I like to recommend to people as well is our Flare ebook. There's so much good information in there. It's like everything I wanted to know as a patient for when you're in a flare.
Yeah. And so many of maybe they aren't even like working directly with us, but we've had so much great feedback coming from that ebook saying how helpful it has been, and really crucial in a lot of people's journeys. So yeah.
Yeah, you did a great job with that ebook, Danielle. And because I'll still get people sometimes that are like, I think I got 1 or 2 calls even in the last couple months that people were like, I feel like I'm good. Like what I got in the Flare ebook like was good enough for me to feel okay right now. So I think that's a big deal. Like when you can create a resource that is able, because creating a good resource is actually able to like solve some problems for someone is not easy to do. I don't know how many times I've ordered something, some kind of book or ebook, and you get it and you're like, great, but how do I use it?
Yeah. We already knew all of these things.
Right. Yeah, that too. Yeah. So do check out the ebook if you need any kind of resource. And yeah, this was a good conversation. It's nice to hear kind of like a snapshot of what you would all, what we would do differently. What am I trying to say?
I don't know. Just kidding.
Thanks for hanging out with us and listening to us share a little bit about our own journeys. And yeah, let us know if you need any support. We're here for you. And if you'd like to work with us, check the link below and reach out to us.